On average, America's doctors, taking all comers for all these key diseases, when you come to the doctor or the hospital, we get it right, according to published evidence, about 55% of the time. Now, Bill, I was thinking about this. Imagine if you wired my house and you got it right about 55% of the time. I'd be after your tail, that's for sure. Except here's how it works. When you're in that examining room, and we've got you sitting on that funny tissue paper on that exam table, and the ambient temperature's about 55 degrees Fahrenheit, you know, there's good research evidence that in that environment, your IQ falls by 40 points. How about this report card? A currently available report card from our colleagues in Madison, Wisconsin. You could read in the upper right, choose a hospital with fewer mistakes, complications, and deaths. Not a hospital with a lower severity adjusted morbidity and mortality. Most doctors couldn't tell you what that means. This is the kind of information you as a group with all of your power ought to be agitating and demanding from every hospital, every managed care company you work with. You've got the power. You should exercise it. And then you can have a seat at the health reform table. In Pennsylvania, 2 years ago today, I was in Washington, D.C., when we unveiled the first ever hospital-specific, naming names, taking no prisoners, the first ever hospital-specific, hospital-acquired infection report. Maybe you remember this report. Maybe you read Julie Appleby's front-page story in USA Today and her follow-up piece that ran for 2 subsequent days. My phone and email basically exploded in November 2006 when we debuted this report. Why? No hospital, no state had ever previously publicly released its hospital-acquired infection rate. Today, only 11 states, in addition to the great Commonwealth of Pennsylvania, only 11 other states compel hospitals to release this information. When you get home, I want you to check on your state. I want you to call your state legislators and say, hi, I'm from this really important national organization. We had 4,500 people in San Antonio, and we want to know what's the hospital-acquired infection rate in the major institutions we do business with. And ladies and gentlemen, if they can't get you the information, my advice is go elsewhere. Ladies and gentlemen, thanks again.
Great job.
Thanks.
Really good. Thanks.